Hello everyone, I'm Dr. Rakesh Patkar, VP Healthcare of PlusCare International and Head of Department of Histopathology. Today I'm bringing a very important topic. The topic is breast cancer. Breast cancer is one of the commonest cancers in India with an incidence over 1 million per year. That is just the reported incidence again. Now, what causes breast cancer? Why is it important? Why is it missed? And what role do we as PlusCare have in the management of breast cancer? Okay. Now, breast cancer basically the conventional school of thought is that it is because of increased hormone exposure. A woman who has her periods early in life and then has menopause late in life has a longer exposure to estrogen. So that increases the chances of breast cancer because breast is hormonally sensitive. Obesity, which again influences hormones, bad lifestyle, physical inactivity, a bad diet, a high fat diet, these things have shown to play a role. However, recently we have seen breast cancer occurring in people even in their 30s and 20s. So now we realize that breast cancer is a genetic disease. In fact, if you have a family history of breast cancer, ovarian cancer, some pancreatic cancers, or even in the male people in the family, prostate cancer, there is an increased risk of breast cancer and you have to be treated for managed for the same. So you can get to know by genetic testing, which is not very expensive. You can get to know whether you will have such a disease or not, and you can be prevented at a very early stage. So basically, how does breast cancer present? The reason why it's missed is that it is very non-specific. A woman may have a slight lumpiness in the breast or may have a firm lump. She may have a nipple discharge. Sometimes it may have blood in it, sometimes it may have pus in it. So they may think it's an infection of sorts. Sometimes there is redness of the skin. Later stages there can be skin puckering or a firm mass which when you try to move it, the skin is just attached to it and adherent to it. Sometimes they can have swelling in the armpit or the axilla. That is because the cancer may have spread over there. Now, regarding breast cancer, what we do at PlusCare is we take a triple approach to it. We do a clinical examination, predict the possibility of it being a cancer. We do a biopsy or a FNAC, biopsy we prefer, and the mammographic findings. A dense breast on mammography has a higher chance of breast cancer. All of these findings are then correlated and the findings are communicated to the clinician. If there is just a lump and we pick up a breast cancer at an early stage, that patient can be completely cured. Something else which we do is immunohistochemistry. That lets us know whether the breast cancer is sensitive to hormone therapies or not. If it is, we deprive the person of hormones by giving medicines like tamoxifen. On the other hand, if it is not responsive, then there is no point in giving those medicines. Then we do genetic testing and we use the latest FDA approved therapies to manage this patient. So you can trust us and have faith in us and come to us because it's a familial cancer. So if you know anyone, if your friends or anyone in your family has it, they should get tested for it, definitely. It can save lives.